Welcome everyone today to our webinar. Thank you for joining us. My name is Danielle James. I'm the Black Maternal Health and Reproductive Justice Engagement and Learning Coordinator with Canadian Women of Color Leadership Network, CWCLN, and we're really glad to be here today with all of you. We're going to be doing some learning, and yeah, we're really looking forward to this presentation. I just want to give my co-host Erica a chance to introduce herself a little bit, and then we'll get started.
Thank you, Danielle. Hi, everyone. My name is Erica Kamikaze. I am a community engagement coordinator with Ottawa Public Health, and I'm 1 in 4 of the Canadian Women of Color Leadership Maternal Health Working Group. Bonjour tout le monde, je m'appelle Erica Kamikaze et je travaille en engagement communautaire à Santé publique Ottawa et je fais partie de l'équipe qui travaille regardant la santé maternelle des femmes noires. Enchantée.
Bonjour. So bonjour tout le monde. We're going to start with our land acknowledgement. Today, as we gather today, we acknowledge with deep respect the ancestral lands of the Algonquin Anishinaabe people, along with all First Nations, Inuit, and Métis people, whose lands we were privileged to stand upon. We honor their enduring stewardship of these lands. The Canadian Women of Color Leadership Network, CWCLN, recognizes that our office is located on the unceded and unsurrendered territory of the Algonquin Anishinaabe Nation. We express our gratitude for the opportunity to be present here today and reaffirm our commitment to working in solidarity to improve the lives of our diverse communities on this shared land. CWCLN is dedicated to the ongoing process of decolonization and fostering meaningful partnerships with Indigenous communities.
Nous reconnaissons avec profond respect les terres ancestrales du peuple algonquin-anishinaabe, ainsi que celles de tous les peuples des Premières Nations Inuit et Métis, sur lesquels nous avons le privilège de vivre et travailler. Nous reconnaissons et honorons aussi leur lien profond et durable avec ces terres. Et nous avons la conviction et nous voulons continuer à travailler ensemble pour rétablir pour établir l'union et puis le respect de toutes des personnes algonquin-anishinaabe.
We also take a moment today to honor, acknowledge, and give thanks to our ancestors, those who came before us, stretching back through time to those proud African queens and kings from whom we are all descended. We remember our roots and all our brothers and sisters of African, Caribbean, and Black heritage who laid down the path we now walk. We remember our shared heritage, we celebrate our great diversity, and we acknowledge the struggles our mothers and grandmothers overcame so that we could be present today. Today, we are the vessel for all their hopes and dreams. May their hands be on our shoulders as we do this work.
Today's webinar is on Black maternal health and STBBIs, and our guest speakers will be Azizat and Fatima. So Azizat works for Somerset West Community Health Center, and Fatima Ahmed Suleiman from the AIDS Community of Ottawa. Azizat is an African, Caribbean, and Black HIV strategy worker, and Fatima is a women's outreach worker, coordinator as well. We also want to thank them for kind of helping us make sure that this session is going to be both in French and English. Donc aujourd'hui, le webinaire porte sur la santé maternelle des femmes noires et des ITSS. Nous avons comme invité Azizat et Fatima. Donc Azizat travaille au centre de santé communautaire Somerset West et Fatima Ahmed travaille avec le comité de SIDA d'Ottawa. Azizat est une intervenante en stratégie pour les communautés africaines, caribéennes et noires vivant avec le VIH. Et Fatima est coordonnatrice de la sensibilisation auprès des femmes. Veuillez accueillir chaleureusement Azizat et Fatima. Nous sommes ravis de vous avoir parmi nous aujourd'hui.
So welcome Fatima and Azizat, and I want to hand it over to you. We're really excited to hear your presentation on Black maternal health and STBBIs. Take it away.
Thank you very much, everyone, for joining us today, and thank you for that introduction, Erica and Danielle. I am Azizat, and with me is Fatima. Today, we are going to be talking about STBBIs and the relationship between Black maternal health and how it also affects us through prenatal, during pregnancy, and postnatal. And we will also touch a little bit about the newborn. So these are the learning goals. I will be defining what sexually transmitted and blood-borne diseases are or infections are. We want to understand what they are, including how they can be transmitted, how can we prevent them, how can we get tested, and what are the treatments available out there for us. We want to also explore the STBBI's specific effects on Black people, especially Black birthing people, during pregnancy, childbirth, and postpartum. We would also examine the implications on newborns, just like I said. So I'll hand it over to Fatima, who will translate that in French.
OK, donc pour ce webinaire, nous parlerons des ITSS et la santé maternelle des Noirs. Alors là, qu'est-ce que c'est un ITSS? Donc, ce sont des infections transmissibles sexuellement et des infections transmissibles par le sang. Dans le passé, on les appelait les MST. Donc, pour les objectifs d'apprentissage, on espère qu'à la fin de ce webinaire, vous serez en mesure de comprendre les différentes infections qui existent et de comprendre leur mode de transmission, de connaître les différentes méthodes de prévention, de dépistage et de traitement qui existent. On examinera aussi les conséquences de ces infections sur la grossesse, accouchement et les conséquences sur la santé du nouveau-né. Merci.
So next slide is about an overview of the prevalence of HIV among Black women. So we know that today we are talking about STBBIs, and HIV is one of them. And we have a lot of data around HIV, but we do not have data that talks about all of the STBBIs together. But because HIV is prevalent and it's a public health issue right now, we want to show you what data we have out there that makes us do this work. African, Canadian, Black people, we call it ACB, and going forward, I may be saying ACB, ACB, ACB. So it means African, Caribbean, and Black. We make up to only 5% of Canada's population, but we account for 25% of new HIV infections. Note, we are not talking about HIV just because it's HIV, but we are talking about HIV because HIV is one of the STBBIs. And most of the time, people who live with HIV have 1, 2, or 3, or at least they are at high risk of having any of the STBBIs that we'll be mentioning today. In Ontario, 61% of women living with HIV are identified as ACB. In 2020, it was approximated that 20% of new HIV diagnoses in Canada were women. So that is why we are focusing on women too. And this proportion remains steady from 2016 to 2020. So it has been like that, averaging 21%. In Ontario, we have 1 of 5 women that were newly diagnosed with HIV in 2020. Race data was collected for 54 of these women, and 44.4% were Black women, 31.5% were white, and 13% were indigenous. So you can see where the numbers are, and that is why we are concerned about our people. Over to you, Fatima.
OK. Donc, pour ce diapo, ça sera l'aperçu de la prévalence et des tendances du VIH chez les femmes noires. Donc, il n'y a pas assez de données pour les autres maladies sexuellement transmissibles disponibles, seulement ceux du VIH qu'on va vous présenter. Donc, selon ces données, 5% de la population canadienne sont issus de la communauté ACB et dans les 5%, il y a plus de 25% de nouvelles infections par le VIH. Seulement en Ontario, 61% des femmes qui vivent avec le VIH sont des femmes noires. On peut voir aussi qu'en Ontario, en Ontario, 105 femmes ont reçu un nouveau diagnostic du VIH en 2020. Et sur ce nombre, 44,4% étaient des femmes noires, 31,5% des femmes blanches et 13% des femmes autochtones. Cela peut nous indiquer que les femmes noires au Canada sont les plus à risque d'avoir une infection sexuellement transmissible.
So now, what are the risk factors? we said that you saw all those prevalence and we are giving you numbers, but for you to know that these numbers are true, we want to go into what is not medical, what we can all see, what we can all know. And that is why we are showing you the social determinants of health. I may not be able to touch everyone today, but I will try to help us relate them to each other so that we can justify why we have those numbers that we showed in the previous slide. So now, risk factors, why people can have or can live with STBBI, or why they can what's it called? Why they can be infected. So we have racism and discrimination. So now we said that ACB have high numbers. Is it true or not? Fine. ACB fall in that category of new immigrants to Canada, right? So, and ACB, the Black people have been confirmed to experience racism, whether in the neighborhood, at their workplaces, or anywhere. So that can predispose them to contacting STBBIs. Then child abuse that leads to adult trauma, right? Those things can also predispose people to contracting STBBIs, and I'll tell you why. Now, gender equality and misogamy, we have education and skills, we have violence against women. So I am a woman, I am an immigrant, I am ACB. You're not sure whether I have childhood trauma, but most of us actually have childhood trauma, even right from how our parents treated us, which they never knew what it could result into. So you would agree with me that as I am here in Canada, my poverty level is high because I can't compare myself with somebody that was born in Canada and has been privileged to go into a good school, to have all the government support from childhood. Their parents are well educated. They know exactly how the system works. But for me, that is just coming to Canada, I have to figure all that out as an adult. So the time I'm taking to figure all that out, I can't figure out my economic level at the same pace. So it will take me some time before I can measure up to that standard of living that is expected of an adult of my age. So it is not something that lingers forever, but it is among new immigrants. So that is why we have put immigration status here. So now, out of these new immigrants, we also have people that are on refugee status. We have people that came with PR. We have people that came on student visa. So all these situations actually predispose people into contracting STBBIs because, number one, let's assume that I come into Canada. I meet somebody who wants to be my boyfriend. Because I don't know how the system works, I may not even know where to get a condom. Fine. Because this person is white, for example, let's assume this person is white, I may be afraid to even ask what their status is. They may not have told me whether they are living with any STBBI or not, and I may not be able to ask because I'm an immigrant. I don't know where to ask questions. I'm poor. I'm still thinking of how to get my papers. All of those things work together to to predispose people into contracting STBBIs. Another thing that I want to mention is education and skill. What is my education level while coming to Canada or before I came to Canada? What have I been exposed to before coming to Canada? Because back home, some of us believe that all these things are spiritual. So if we are coming into Canada with the mindset that this is a spiritual attack, then I wouldn't care whether to do prevention or get tested or ask my partner if that is applicable or discuss with my partner. Let's assume I am the one living with the STBBI too. I may not be able to discuss with my partner because I'm not educated enough to know how to discuss with my partner what my status is. So all those things are what we are talking about. Then when one person falls under all of these social determinants of health, we call it like intersectionality. So it means that because my risk is high, it means that if I am not exposed through this means, I may be exposed through this means. For example, if I am a drug user and I don't have money to buy new syringes to use my drugs, I may have to take a syringe, a used one from somebody else. And you know that when that happens, when people inject themselves with syringes, there will be traces of blood. So that blood contact can actually transmit an STBBI to me. I'll stop there and allow Fatima to explain this more in French. And I hope that you've gotten the explanation. And if you have questions around this, we are still here after the session, but we still have a lot of things to cover. So I won't be able to take each social determinant of health and explain how it relates to contrasting STBBI. Thank you. Fatima, go ahead.
Ok, moi je vais aller je vais plus résumer. Donc, d'abord, je vais commencer à définir quels sont les déterminants sociaux de la santé. Donc, ce sont des facteurs non médicaux qui influencent la santé des personnes. Ces facteurs comprennent les conditions dans lesquelles les gens vivent ainsi que le système qui façonne leurs conditions de vie. On peut nommer quelques déterminants sociaux de la santé qui sont le racisme, l'éducation, entre autres. Ces déterminants sociaux de la santé augmentent le risque pour la femme noire de contracter des infections, puisque souvent elle subit plusieurs sortes de discrimination en même temps à cause de sa race, de son genre et de son éducation. Cette intersectionnalité peut avoir un impact sur sa santé, sur son accès à l'information et à son accès aux soins. C'est tout.
So now we talked about risks that are natural because you don't determine who your parents are. So you were not the one that actually choose to be from anywhere that you're from. So those ones, we can say that they are not medical and they are not things that are in your hands that you have control over. You may not have control over your immigration status, for example. Maybe your parents were the ones that brought you here. But now we want to look at risk factors that we can actually control, right? Though these risk factors, you may not also be able to control it based on your social determinants of health, where you find yourself in the economic status of life, right? But we also want to bring it to you so that if there is anyone that you as an individual can control, or you can use your support network to control, or the resources that we're going to be sharing here today, if you can use it to help yourself, it will be good. So those are the risk factors that we've mentioned here. Number one, multiple sexual partners. So if you're having multiple sexual partner, which is not a bad thing, if that is what I've chosen to do, we are just here to let you know that you are at a high risk and you need to take charge. You need to be more careful than somebody who has only one sexual partner. You know, we are going to be touching on preventative approaches so that you can also have an idea of, oh, okay, because I have multiple sexual partners, this is how I can create a barrier between myself and the virus that would cause me to have an STBBI. Then anonymous or casual partner. So if you are somebody that does this, like having partners that you don't know or having casual sex, so you are at a high risk of contracting an STBBI. So now look into when somebody is having multiple sexual partners and the same person falls under all of those social determinants of health. You see that the problem is more compounded. So we just have to find our feet and see how we can help ourselves. And that is why we are doing this educational section. Unprotected sex is also a risk factor. Sex with someone who has an STBBI. If you are sure that somebody has an STBBI, fine. It means that you have to take control of your own life and the other person's life. Substance use, drugs and alcohol. So for drug users, they're also at a very high, they have a very high risk, not only because using drugs may cause people to misbehave, but because they can partake in needle exchange program, needle exchanges from an individual who already has or is living with an STBBI. And for alcohol, if you take a high percentage of alcohol, it can also cause people to misbehave or do something they wouldn't have done normally. So for somebody who takes alcohol, if they take a very maybe concentrated one, they may find themselves having multiple sexual partners. They may find themselves involving in casual sex. So that is why people who use alcohol are also categorized under people with high risk. Then history of sexual violence. We all understand what sexual violence is. Sexual violence is finding ourselves in a situation where we have to have a sexual intercourse forcefully. So then if it is a forceful one, it means that I wouldn't have understood who the person is, whether the person is anonymous or not, I don't even know, right? Whether the person is living with an STBBI, I wouldn't have known. So if that is in anybody's history, it means that they have a high risk of contracting an STBBI. Fatima.
OK. Donc, tout à l'heure, nous avons dit que une personne qui subit plusieurs sortes de discrimination peut avoir des difficultés d'intégration, d'accès à l'information et aux soins. Elle peut aussi être instable et avoir des comportements à risque. Mais ces risques peuvent être contrôlés par différentes manières. Donc, ici, nous avons noté plusieurs exemples à ne pas avoir pour éviter d'avoir les maladies sexuellement transmissibles. Donc, comme avoir plusieurs partenaires sexuels augmente le risque puisqu'on ne sait pas c'est quoi le statut de chaque partenaire. Avoir des relations sexuelles avec des partenaires anonymes ou occasionnels aussi peut être un facteur de risque. Avoir des rapports sexuels non protégés, effectivement, puisqu'on ne sait pas si notre partenaire a des OK. Si on ne sait pas si notre partenaire a des maladies sexuellement transmissibles. Consommer des substances comme la drogue, l'alcool peut nous pousser à avoir des comportements à risque, comme partager les aiguilles ou ne pas penser à se protéger avant d'avoir des relations sexuelles. Donc, les personnes qui ont subi des violences sexuelles peuvent avoir des infections sans le savoir. Donc, c'est pour cela qu'il est très important de se protéger et de se protéger et de faire les dépistages nécessaires avant d'avoir des relations.
Now, let's go into the transmission modes. How can STBBI be transmitted from one person to the other? There are three basic ways, which can be sexual, blood-to-blood, or vertical transmission. For sexual transmission, it can be real, like skin-to-skin sex. It can be oral sex. It can be using unprotected sexual objects. So even though you are not having sex with an individual, what if the object that you are using has actually been used by somebody who had STBBI and their semen or something is on it? So one can actually contract it through using that unprotected sexual object. Then skin-to-skin friction, which can be like, let's say, anal sex, and then oral sex, which can also pass semen or any of the liquid that could make people contact an STBBI from the bloodstream of the other person. Then the blood contact would be the situation where the virus is going directly into the bloodstream, which we have seen rare cases from blood transfusion, which is actually a legal thing, right? Which is actually getting the blood transfusion means that you want to heal something. And we have seen people actually contracted because maybe the blood was not well screened or something like that. Another example would be tattoos and piercings, which can actually, if the equipment used is not sterilized and somebody that had STBBI has already used it. Those are examples of blood-to-blood contacts. And also the one I mentioned earlier, which is using syringe or needles that has been used by somebody who lives with STBBI and there may be traces of blood in it. Then vertical transmission would be one that is transmitted from mother to child, which could be during pregnancy, during childbirth, or during breastfeeding, which may not be in the child's control. And we also mentioned some of the STBBIs like HIV, hepatitis B and C, chlamydia, gonorrhea, syphilis, and genital herpes. We'll be talking more about them in some of the slides. go over.
OK. Donc, on va parler des principaux modes de transmission des ITSS. Ces infections sont le VIH, l'hépatite B et C, la chlamydia, la gonorrhée, la syphilis et l'herpès génital. Donc, en premier, nous avons la transmission par contact sexuel. Donc, ici, les infections se transmettent lorsqu'il y a contact des muqueuses avec du sperme et des sécrétions vaginales lors d'un frottement peau à peau, d'un rapport oral, vaginal ou anal, ou par exemple lors des partages des objets sexuels. Ensuite, nous avons la transmission par contact de sang à sang, ce qui veut dire que les infections passent directement dans la circulation sanguine. Par exemple, lorsqu'une personne utilise les matériels d'injection ou d'inhalation de drogue contaminée, cette personne peut infecter. Pour finir, nous avons la transmission verticale. Donc, c'est la transmission se fait de la mère à l'enfant pendant la grossesse, lors de l'accouchement ou de l'allaitement dans certains cas.
This slide just shows the specific tool that actually transmits this virus, that takes them from one person's body to the other. So we have the blood, they're all liquid or fluids, right? So we have blood, which is in the case of needles and syringes or blood transfusion or tattoos. We have semen, which could be through oral sex or anal sex. We also have vaginal fluid, which we could also be oral sex or vaginal sex. We also have the anal fluids. We have the breast milk, which is the one for vertical transmission. But you would agree with me that all these are liquids through which there must be a movement. So for somebody to get infected, there must be a movement of the virus from one person's body to the other. And these are the verticals. So, I mean, these are the vehicles that transmit the liquid.
Donc, nous avons parlé des modes de transmission tout à l'heure et là, on va parler des fluides biologiques utilisés par les infections pour circuler. Donc, ce qui veut dire, ces fluides sont le sang, le sperme, le pré-sperme, les fluides vaginaux, les fluides anal et le lait maternel. Ce qui veut dire là, les infections utilisent ces fluides biologiques pour être transmis d'une personne à une autre.
Now let's talk about prevention. There is one adage that says prevention is better than cure. So we want to talk about the prevention before we talk about the cure, because it is better not to have it than having to cure it. So if we have the power to prevent it, why not prevent it? But once we see that, oh, this is existing, then we have to treat it. But for now, let's look at the preventative approaches. Testing regularly for HIV or other STBBIs can be a very good way of prevention, because you always know what your status is. And this testing can come in different forms, depending on what your doctor would recommend for you when you tell them you want to get tested. Urine tests can happen, swabs can happen, blood tests can happen, pap smear, which is now HPV, can happen. However, the best approach would be what your doctor has actually perceived due to whatever you have told your doctor. So for example, if you've involved yourself in a casual sex before you go to your doctor may ask you, are you experiencing any symptom? So all of those questions, when they answer them, that is what determines if they will ask you to go for a urine test or a blood test, because those viruses are not they don't function the same way. Some may be more visible in urine at a particular stage, while some would only be visible in other fluids in the body at a particular stage. This prevention involves creating a barrier between the virus and our bloodstream. So how do you create this barrier? Is it by putting blocks on our body? No. Is it by building a house between your body and the bloodstream? I mean, and the virus? No, because we all are predisposed to all of this. So one way to create that barrier would be the use of condoms, the use of dental dams, avoiding this needle sharing so that you are sure of what you are using. Another way to create this barrier would be by the use of PrEP and PEP, which are like pre-exposure prophylaxis and post-exposure prophylaxis. And we are talking about exposure to sex or sexual contact with maybe a suspected, or maybe you have a casual sex or something. So these are medications that you can also use. We also have vaccination, which can also protect you from contracting STBBIs. And prevention education pertaining to STBBIs and Black women is a very, very big one, like what we are doing right now. And intentionally getting educated around how to, so I talked about PrEP and PEP. I know that some of us here today may have heard this before, while some of us may not have heard it before. It is now our own responsibility to seek that knowledge, getting that education for ourselves. So if I am infected, how do I communicate to my partner so that my partner can be protected? You know, all of those education are necessary for us as Black women because of our high risk of contracting STBBI.
Donc, ici, pour la prévention des ITTS, pour les prévenir, on doit se dépister régulièrement. Ainsi, si jamais il s'avère qu'on est infecté, une prise en charge rapide peut limiter les conséquences. Donc, le dépistage se fait sous différentes formes. Nous avons le test d'urine, qui est utilisé pour la chlamydia et la gonorrhée. Donc, on a aussi le prélèvement d'échantillons dans le vagin, dans l'anus ou dans la gorge pour la chlamydia et la gonorrhée aussi. Nous avons aussi le test sanguin qui est utilisé pour le VIH, syphilis, hépatite B et C. Nous avons aussi le frottis cervical qui est une procédure courte qui consiste à prélever un petit échantillon de cellules du col de l'utérus afin de les examiner au microscope pour les infections à papillomavirus humain. Il est conseillé de le faire une fois tous les 5 ans et cet examen peut aussi dépister le cancer de l'utérus. Ensuite, au deuxième point, nous parlerons des autres moyens de prévention. Donc, l'utilisation des condoms, des latex dentaux sont très conseillés parce que c'est le moyen le plus efficace pour prévenir la transmission des infections. Ils réduisent le risque de contact direct avec le fluide corporel et les lésions cutanées. Ensuite, il est conseillé d'éviter de partager les aiguilles et autres matériels de consommation de drogue pour éviter d'être infecté. La prise de médicaments de prévention comme la PrEP, qui est un traitement préventif pour les personnes à haut risque d'infection par le VIH, et la PEP, qui est un traitement d'urgence qui peut être utilisé après une exposition à risque comme une rupture de condom pour éviter d'avoir le VIH sont de très bonnes méthodes de prévention aussi. Nous avons aussi la vaccination, qui est un moyen efficace de prévenir certains ITSS, comme les hépatites A, les hépatites B et les infections à papillomavirus humain. Donc, au point 3, nous parlerons de l'éducation à la prévention des femmes noires et pourquoi c'est important. Selon une étude en Ontario, plus de 61% des femmes vivant avec le VIH s'identifient comme africaines, caribéennes ou noires. C'est un chiffre qui est énorme. Elles sont plus susceptibles d'être infectées à cause de leur vulnérabilité due aux différents facteurs qu'on expliquera un peu plus tard. Donc, il est important que les femmes noires soient éduquées à la prévention. Une fois éduquées, elles peuvent avoir accès à l'information, avoir une communication ouverte avec leurs partenaires sexuels pour discuter des antécédents médicaux, des pratiques sexuelles ou du statut en matière de désinfection. De cette manière, elles peuvent avoir une bonne santé sexuelle.
Now, let's go to treatment. We do not have many options around treatment rather than antibiotics, antiretrovirals, and antiviral therapies for hepatitis. So majorly, the prevention for STBBIs, prevention actually carries a huge part of ensuring that we treat it, because it is something that is being transmitted from, a human being to another human being, right? So it means that if we can prevent, we have solved like 75% of the problem. Because when it comes to treatment, you also need to know exactly which bacteria has caused the STBB for the person, or which virus are we fighting. So it's not something that it is not a headache or a slight pain that you can just get into the pharmacy and, get an over-the-counter medication to use. Even a doctor cannot just prescribe anything for you just by your explanation. A doctor would ensure that you get tested so that they can know the sensitivity and what particular organism has caused that STBBI, then what can be used to treat that particular organism. And that also depends on what you have used or who you are. Your doctor would ask you, are you on any medication? Because there are some of these medications that they have interaction in the body. So sometimes you may think that, oh, when my friend had chlamydia, they wrote so to her for her. Or let me start from here. So when my friend had chlamydia, these were the symptoms. So because I now have that symptoms, I now assume that I'm suffering from the same thing, which is chlamydia. And because her doctor wrote a particular medication for her, I want to go buy the medication and use. Let's assume I have access to get a medication. But that may not actually work for you, because you may be somebody who is using another medication that would interact with that particular one that was prescribed for your friend, which would not make it work for you, right? And it may just be another organism that is causing your own STBBI. So it is a little bit challenging or difficult to treat. So by the time you are getting tested and all of that, the virus is already causing more harm into the body stream. So it is just better to make sure that we prevent it. But when we discover that it is there, we just have to take charge and treat it. And we have to take it very, very seriously. Because like we mentioned here, STBBIs living in our system as Black women can actually affect childbirth. There are so many people out there who are suffering from, or who are looking for pregnancy, or they are looking to have children, and the only problem that they've had is the fact that they've once had an STBBI maybe when they were younger and they didn't treat it on time. So it is a serious case. We have to ensure that we treat it once we have it, and we don't want that virus to stay in our body for so long, because they keep destroying things and destroying things in our body system. Go ahead, Fatima.
OK, donc là, pour les traitements qui sont disponibles pour les maladies sexuellement transmissibles, il n'y en a pas beaucoup. Donc, nous avons les antibiotiques pour les ITS bactériennes, nous avons les antirétroviraux pour le VIH et nous avons les thérapies antivirales pour les hépatites.
Yeah, so this slide just wants to reiterate the fact that we as Black women need to be more serious with our health, and we need to also tell our friends to do the same thing. Black communities, so this is the disparities in STBBI impacts. Black communities face higher rates of STBBIs due to systemic inequities. This goes back to social determinants of health, because this is a systemic thing and you cannot control it. So it means that the only thing you can control is prevention and treatment, right? So takes us back to prevention and treatment. Then barriers to care. That is also not in your hands. The stigma that we face, the racism, the healthcare access, provider bias, social determinants of health play a significant role. And these are not things that are in our hands to control. We are not the ones to determine how many healthcare providers would be Black people. Even though we can contribute to that policy change or systemic change, but we can't continue to wait for that to determine our own health status. What we have control over is prevention, education, and treatment. Go ahead, Fatima.
OK, donc la femme noire est confrontée à des taux plus élevés des infections en raison d'inégalités systémiques et le racisme systémique. En effet, le racisme systémique dans les soins de santé peut entraîner des diagnostics tardifs, des traitements inadéquats ou des retards dans les soins, puisque lors de la prise en charge de ces femmes, les hôpitaux ou les centres de santé, les symptômes ressentis par ces femmes sont minimisés par les professionnels de santé. Parfois, les femmes noires sont perçues comme plus résistantes à la douleur, ce qui mène à une sous-évaluation de leurs besoins. Il y a aussi très peu de soignants racisés ou des soignants formés à la sensibilité culturelle. Donc, en fin de journée, les déterminants sociaux de la santé jouent un rôle très important sur la santé de la femme et à son accès à, à la santé.
Now let's go into the Black maternal health overview. As a Black woman, we all well, not all of us, but a larger percentage of us are mothers. A large percentage of us want to be mothers. A large percentage of us are grandmothers, and at some points we fall under this category of being considered as maternal. So Black birthing people are more likely to experience pregnancy-related complications, which I mentioned, because of STBBI. Because when the viral lives in our system, they keep causing harm in the system. The thing is, many of these STBBI don't actually cause us pain. Like, they don't cause you pain when they get started. So sometimes you can just neglect and move on with your life, right? Meanwhile, they are causing harm into our system. So when it comes to getting pregnant, people start having problems because we also have limited access to respectful and comprehensive care. It's also a reason why we are more likely to experience, pregnancy-related complications resulting from STBBI. Then that leads to higher maternal mortality rates. So let's say we are predisposed to living with STBBIs. Then we have limited access to correct healthcare facility or healthcare provider. Then that leads into pregnancy-related complications, which is resulting from limited access to respectful and comprehensive care, which leads to higher maternal mortality rates. That is where you hear that, oh, the person, she went on to give birth, but we lost the mother and the child. Or sometimes, oh, we lost the mother, but the child is there. Sometimes premature death for babies and all of that. So STBB has a compounded risk, and which is resulting from all of these things. And you know that without STBBI, we are predisposed to other things that leads to pregnancy-related complications already, right? So when STBBI now adds into it, it is a lot of problems. And to treat an STBBI when somebody is pregnant is another level of problem. Go ahead.
OK, donc à cause des inégalités systémiques et à certains déterminants sociaux de la santé, certaines femmes n'ont pas accès à certains dépistages, certains soins et traitements à temps. Ce qui fait que les femmes qui accouchent sont plus susceptibles d'être confrontées à certains problèmes de complications liées à la grossesse, d'avoir un accès limité aux soins respectueux et complets, ce qui peut nous amener à observer un taux de mortalité maternelle plus élevé.
So going forward, we also want to show you some key points. A study followed 77 women with HIV in Ontario from late pregnancy to 1 year postpartum, and discovered that HIV stigma increased after birth, but did not show significance at each time in point. Depression and perceived racism were significant predictors of HIV-related depression and stigma during both pregnancy and postpartum. So this slide is also just showing us how STBBI is related to childbirth. So you would have heard postpartum depression, right? There are many people who actually go through postpartum depression resulting from STBBI, which means that if this person, maybe the person lived with an STBBI before the person was able to get pregnant. They have gone through a lot of stress. By the time the pregnancy is there, they have to stay in the hospital for maybe a longer period of time. Maybe because in addition to that, they are facing racism. Maybe when a doctor is supposed to attend to them, they are sending to another person. You know, like all of those things makes it very, very tough. But if we can remove the STBBI part of it, then we can know that, okay, we have little problems that we are facing. Go ahead, Fatima.
Donc, selon une étude menée sur 77 femmes séropositives en Ontario, depuis la fin de leur grossesse jusqu'à 1 an, ces femmes ont constaté qu'après leur accouchement, la stigmatisation liée au VIH a augmenté, mais pas de manière significative par contre. Ces femmes souffrent de dépression et ont subi du racisme. Cette situation peut amener les femmes d'arrêter d'aller voir leur médecin régulièrement et cela peut affecter leur santé. Donc, en tant que prestataire de santé, ils doivent fournir des soins sans jugement pour que la femme noire soit confortable et continue à être connectée avec eux.
So we want to touch on vertical transmission, which is mother-to-child transmission. We are reiterating this because even though if I discover that I live with an STBBI, how do I safeguard my baby? How do I, that alone can actually cause postpartum depression, right? Because I'm having a baby and I'm not even sure how to protect this baby because I live with an STBBI, and I know that through breast milk, my baby can actually contract an STBBI. So how do I live with that? All of those trauma is something that's should be talked about. So transmission from mother to child during pregnancy, childbirth, or breastfeeding makes it very, very important for our people or for our ACB women to ensure that they get prenatal care. Remember again that because we are ACB, you may not actually get this prenatal care on time. So you have to make sure that you are struggling for it. You have to make sure that you use every support system and network that you have to ensure that you get prenatal care, because it is very, very essential for you compared to somebody who is free of an STBBI. So it doesn't mean that because I'm free of an STBBI, I shouldn't seek prenatal care, but because the other person is at a higher risk, then they need more support. That is why if I'm a nurse or I'm an healthcare provider, and two people showed up, two pregnant women showed up, and there's only one doctor that is available, I would allocate this person, match them with a doctor first before I'm able to get somebody else for this woman who do not live with an STBBI. So that ensures that both the mother and child's health is preserved. So health professionals will ask about your STBBI history when you are pregnant. They would do some tests and, recommend tests for you. So when these things are being recommended, as a Black woman, there are so many things that we reject. Oh, I'm okay. I'm not doing that. No, they're asking, oh, this stress is too much. They ask me to do all of these tests. I've done them before. No, they know what they are doing. So as a Black woman, because of this high risk, that is why sometimes we have to go through all of this stress just to safeguard ourselves. It's not that the system is fine. We know that the system has its own issues, but there are some things that are necessary for us just because we are Black people, just because I'm a Black woman, just because I'm an immigrant. I have a higher risk of contracting an STBBI, and I have to go through some screenings, which my doctor would recommend for me, and I have to make sure that I follow them. Go ahead, Fatima.
OK, donc les femmes noires sont plus à risque d'avoir les ITS. Donc, elles doivent faire sûr de faire leur dépistage, surtout si elles sont enceintes. Donc, ici, on va parler des transmissions verticales, qui est une transmission des infections qui se fait de la mère à l'enfant pendant la grossesse, l'accouchement ou l'allaitement. Pour éviter que la transmission se fasse, il est important de faire les soins prénataux. Ainsi, si la mère est infectée, elle peut prendre des traitements pour que l'enfant reste en santé. Et donc, c'est ça, si la femme est enceinte, un suivi de grossesse est essentiel afin que l'enfant et la mère soient en santé. Lors des rencontres de suivi de grossesse, les professionnels de santé demanderont à la femme si elle a eu déjà de l'herpès génital ou d'autres ITSS et lui recommanderont des examens de dépistage de certains ITS.
Now, STBBI during pregnancy can lead to premature birth, which is something that I mentioned. And these are, so for me, for somebody that has an STBBI, they've gone through a lot of stress, getting pregnant. You know, some have to go through an IVF. You know, these are stresses on them on their own. Then by the time the person now have a premature birth, that is another level of trauma. So miscarriages, stillbirth, it may increase the risk of transmission to your baby. And HIV and syphilis have very, very serious implications on fetal development. And these are as a result of untreated infections, because many of these infections are asymptomatic. You don't know that you have them until you get tested. Go ahead.
Donc, pendant la grossesse, les professionnels de santé, lors du suivi, ils vont demander aux femmes enceintes de faire des analyses de sang, d'urine et des prélèvements vaginaux qui sont prescrits pour pouvoir déterminer si elles ont des maladies sexuellement transmissibles parce que des fois, on peut avoir ces infections sans pour autant avoir les symptômes. Donc, les tests de dépistage qui seront prescrits de facto, c'est pour la chlamydia, gonorrhée, hépatite B, syphilis et infection pour le VIH. Et les conséquences possibles d'une ITS, ITS sur la grossesse ou la santé du bébé, c'est que la femme peut faire une fausse couche ou accoucher prématurément, faire une infection intra-utérine ou accoucher d'un enfant mort-né. Donc, c'est vraiment euh, comme il faudrait vraiment qu'on prenne ça très au sérieux, faire les examens nécessaires, les dépistages nécessaires pour prévenir tout cela.
Now, what options do you have when you are pregnant? Like I mentioned earlier, for infections, the treatments are limited, right? So when you are now pregnant, there is consideration for the baby too. So from all of these treatments, do you know the one that is going to affect your baby? So doctors are always very careful, or healthcare practitioners are always very careful to recommend or say that you should use any form of treatment until they are very, very sure that it's not going to affect the baby. So most of the time, or in some cases, it results into a cesarean delivery. And in newborns, there is a lot of monitoring and evaluation that has to take place so that the treatment of that infection can happen in the baby. So most of the time, especially when it is detected lately, it will be a cesarean section, then monitoring and treating the baby. But make sure that you are working with your healthcare provider and you are telling them everything you are going through so that they can treat you accordingly. Fatima.
Donc, lorsqu'une femme est détectée, dépistée d'une infection, plusieurs actions peuvent être prises pour elle. Donc, chez la femme enceinte, elle peut commencer un traitement de l'infection et dans certains cas, un accouchement par césarienne peut être recommandé. Et ensuite, chez les nouveau-nés, ils vont faire une évaluation et suivi de la santé et au besoin, ils le mettront sous traitement.
Some of the impacts on newborn health could be passing the infection from the mother to the baby. If it ends there, yes, we can treat it, right? But if it doesn't end in just the baby having this infection, it may result in neurological damage for this baby. We have seen cases whereby the baby's skin or eye has damages, or they are not functional 100%, they are not optimal. And we have also seen cases of liver issues, and we are also seeing cases of developmental delays. I mean, when the child is supposed to talk, they reach their milestones lately. Then early detection and treatments can prevent or mitigate the effects. So it means that for you to have an early detection, you have to ensure that you are getting tested when it is necessary to get tested, or your routine test. Fatima.
Ok, les impacts sur la santé des nouveau-nés sont très graves, peuvent être très graves, parfois même mortels. Les nouveau-nés peuvent développer une infection chronique comme le VIH ou l'hépatite B. Ils peuvent aussi développer une forme plus ou moins sévère de la maladie comme l'herpès ou le syphilis congénital, ou encore le nouveau-né peut développer des complications qui peuvent avoir des effets permanents sur sa santé et son développement, comme par exemple la gonorrhée il peut avoir une infection grave à l'œil, l'œil pouvant le rendre aveugle s'il n'est pas traité de la gonorrhée. Et chez le nouveau-né infecté par la syphilis, le nouveau-né peut développer de l'anémie ou des anomalies du foie, par exemple. Et ensuite, l'herpès chez le nouveau-né peut amener à un retard de développement. Donc, ces complications peuvent être évitées ou limiter les conséquences si un dépistage tôt et un traitement précoce ont été considérés.
So this one is an infographic showing recommendations in newborns, like for if you have a newborn and you live in an STBBI, what are the recommendations out there? These are just for information purpose or for education purpose. You need to consult with your healthcare provider for what is specifically applicable to you, because treatment of an STBBI or the control and monitoring is an individualized approach basis. You cannot generalize, right? So there are cases where something like this would not be what it is. So you have to consult your doctor. But these are some of the recommendations. For HIV, can it be transmitted through breast milk? Yes. And can you breastfeed your child when you live with an HIV? No, except in specific cases. So you cannot say no for everyone, right? But these specific cases, am I one of the specific cases? I don't know. So I have to consult my healthcare provider. So the recommendation is strict antiretroviral treatments and exclusive breastfeeding in resource-limited settings. I know that I've once worked with once worked on a nutrition project where what was recommended is strict exclusive breastfeeding for mothers that are using their antiretroviral treatment. Basically, they cannot transmit it to their kids, to their babies. But if those children would maybe take water for one day, then you have broken it, right? So that is why you have to work with your healthcare provider. Hepatitis B, can it be transmitted from mother to child through breast milk? No. Is breastfeeding allowed? Yes. Allowed if baby received vaccine, right, at birth. So what if your baby was not opportune to receive the vaccine at birth? Maybe your baby received this when they were maybe 2 weeks old or 3 weeks old. Then how strong is the baby's immune system? You know, so you have to know all of that. So it cannot be yes 100%. Then hepatitis C, it is very rare for it to be transmitted through breast milk. It means that breastfeeding is allowed, but you also need to avoid breastfeeding if this hepatitis C has caused a crack or bleeding on the nipples. Then genital herpes, no, they cannot be transmitted through breast milk. Is breastfeeding allowed? Yes, but do not breastfeed from a breast with a lesion. So fine, it is breast milk that you want to give the child, but if there is a lesion, it means that the child will get something else from the breast, right? So that is why breastfeeding would not be allowed. So if your medical provider says that, oh, you cannot breastfeed your child, no, it's not that they hate your baby or they hate you. It's because they have seen what can predispose, or they see that you are at a higher risk of transmitting it to the child. Syphilis, it is not transmitted through breast milk, and breastfeeding is allowed, but you need to avoid it if there is an active lesion. Gonorrhea, the same thing. You also want to check if this person is using their medication for that treatment. I mean, for that ailment. Chlamydia, no, but it's also same as above. So all of these things, like I said, they are not cast in stone. You have to work with your healthcare provider. Fatima.
Ok, donc la transmission des infections lors de l'allaitement est principalement limitée au VIH. Donc, si la mère ne sait pas qu'elle est séropositive, elle peut transmettre le VIH lors de l'accouchement ou pendant l'allaitement. La seule manière d'éviter la transmission est d'avoir une charge virale indétectable et pour cela, il faut se faire dépister et accéder au traitement. Pour les autres infections, il n'y a pas de transmission possible par le lait, à part pour l'hépatite C qui demeure très minime. Il est donc important de suivre les recommandations des médecins et d'éviter l'allaitement si nous sommes porteurs des infections et ne sommes pas sous traitement.
This is our, I think, almost the last slide, and it talks about addressing inequities. And so I want you to look at this slide as not talking directly to you, but talking to all of us. So what I'm trying to say, so there is this a prime minister of England around 1941 to 46 or thereabouts, who said that if everyone defend his home, the whole England will be defended. So what we are talking about here is if I do my bit and you do your bit and everybody, does their bit, then we can get the results that we want. So how do we address inequities? It is not only in the system, it is not only in my hands, and it is not only in your hands, but there is one thing that we can contribute to addressing inequities. Culturally competent care. So even if the system provides healthcare providers that are competent and they provide the training for you to be competent, are you as a healthcare provider ready to provide those competent care, the culturally competent care? Are you sensitive enough? Have you decided to ensure that you are being culturally sensitive when you are attending to your patients, right? So that is a question for you to answer and for me to answer. Community-driven health education. Are you involved in community-driven health education? Are you putting the community people at the back of your mind? Then this is to a healthcare provider too, right? Then improving provider training on racial bias. Fine. I may not be the one to improve this training on racial bias, but you looking at me or being here today may have the opportunity to support this development of or improvement of training that really talks about racial bias to our healthcare providers. Policy change may not be your work or may not be my work, but we can also, improve on our advocacy to ensure that there is policy change that ensures equitable healthcare access for everyone. Fatima.
Ok, donc pour combattre les inégalités que peuvent rencontrer les femmes noires, il faut tout d'abord adopter les soins selon les cultures de chaque femme pour qu'elle se sente bien et comprise par les prestataires de soins. Il faut aussi que l'éducation à la santé soit axée sur la communauté pour mieux comprendre leurs besoins. Il faut aussi améliorer la formation des prestataires en matière de préjugés raciaux. Il faut, euh, euh, il faut aussi faire un changement dans les politiques pour permettre à cette tranche de population d'avoir un accès équitable aux soins.
Yeah, so I think this is our last slide before we get the resources slide and the references. So these are the key takeaways from today's session. We have spent a huge 1 hour of your time, and I want to believe that I've not wasted your time today. I want to believe that you've taken something away from this presentation, because I spent a lot of time looking at what information to give you people and what information you do not need. What information can be beneficial to you in this your 1 hour of staying with me today. Takeaway from this session would be the fact that STBBI can have serious health impacts, especially during pregnancy. That is one thing you need to know. So if you're pregnant, you're thinking of getting pregnant, your sister is thinking of getting pregnant, you have pregnant people around you, please tell them that STBBIs have serious health impacts. Then let them know again that Black birthing people face unique and disproportionate risk. And that is why you get all of those tests to be run. And maybe your white friend is not getting them. That is because we are Black and you have to go through all of that. Then prevention, early detection, and culturally competent care are very, very essential to support us from contracting STBBI and treating it. Advocacy is key to improving health outcomes, even apart from STBBIs. Advocacy is a very, very serious thing, because when the leaders up there are not, or when an individual is not experiencing something, sometimes they do not believe that it's existing until somebody brings it to them and give them justification to ensure that we need to, this is a menace, this is something that we need to talk about, this is something that we need to support. Thank you, Fatima. You can do that.
Oui, donc merci de nous avoir écoutés jusqu'à date et j'espère que notre présentation a été assez informative pour vous et que vous avez pu retenir quelques notions et on sera ravis de répondre à quelques questions.
Okay, thank you very much. The other slides are the resources and references. We have 2 questions from the question and answer. The first question is, what is the percentage of newborn that got HIV from women with HIV? So I do not have this data. I don't know whether Fatima has that data.
No, I don't have to.
Yeah, there has been a lot of work ongoing in respect of this, you know, and in some countries, they've actually restricted anybody living with HIV not to breastfeed. So the data, I mean, because the ultimate cure is prevention, right? So instead of risking it for a mother who lives with HIV to do exclusive breastfeeding, which may not be possible, some countries have restricted people living with HIV from breastfeeding their children, and they've supported them by with getting, you know, pure breast milk. You know, that is where we have programs like donor milk, you know, and all of that, right? So your child can actually get human breast milk without you breastfeeding the child. So that, I would not say that has solved the problem 100%, but a lot of work is ongoing. But if it is percentage of newborn who contracted an STBBI from their mothers, that is large, but I also do not have the number here. This person can reach out to me and I will get you that number. And maybe you can be specific with the country or maybe a province from which you want that data. Or does anybody have the data? Erika?
No, I don't, but I think we can always email back the person with their question and make sure that they receive the answer, and also the participants as well.
I want to send a big thank you to Azizat from Somerset West Community Health Center and Fatima with the AIDS Committee of Ottawa for sharing all of this information with us today. I think, you know, Azizat, you kind of said it yourself that there's a lack of targeted public health information towards, you know, about STBBIs targeted towards Black women and femmes and families. And it creates this gap in our knowledge. And like you said, you know, these opportunities to learn from you and Fatima and just hear this information, hear about testing, hear about screening, and hearing it from community is really, really important. This kind of community-led education is so vital. So thank you so much for joining us today. I also want to thank our partners at Southeast Ottawa Community Health Centre for supporting this important work, and also to Ottawa Public Health and Erica. We appreciate Ottawa Public Health's ongoing support for this important work in Black maternal health and reproductive justice. I want to say thank you to everyone who joined and asked questions and contributed to this conversation. We're glad that you could join us. We hope to see you guys. We're going to be doing more of these workshops and webinars, sharing information about Black maternal health and reproductive justice on topics, everything from periods all the way to menopause. So we hope that you'll keep an eye out on our social media, keep an eye out on our website, follow us on the social platforms, Instagram, Facebook, LinkedIn, to keep up to date on the events and activities as we continue to learn and do more in this work and advocate.
I'm going to do my best, Danielle. On voulait spécialement remercier Azizat et Fatima de vraiment nous avoir partagé beaucoup d'informations sur les modes de transmission, les dépistages, l'importance de l'impact que ça peut avoir sur notre santé maternelle et celle de nos enfants aussi. Et puis ça fait toujours plaisir de pouvoir avoir cette information qui vient des membres de notre communauté qui travaillent aussi ici à Ottawa. Donc, merci encore, Fatima et Azizat. On veut aussi remercier les participants, mais aussi les contributeurs du travail qu'on fait. Donc, Southeast Ottawa, nous avoir un peu permis d'avoir quelques sessions jusqu'à maintenant. On vous invite à continuer à nous suivre sur nos plateformes sociales, Instagram, Facebook et LinkedIn pour nos prochaines présentations, nos prochains ateliers aussi, qui vont toujours rester un peu dans le thème de la santé maternelle, mais qui va aller vraiment de démonstration jusqu'à la ménopause et périménopause. Donc, on vous invite à continuer à nous suivre et venir et partager aussi les sessions à venir. Merci encore.
Merci beaucoup. Thanks, everyone.
Au revoir tout le monde. Merci d'être resté aussi longtemps. Thank you again. Bye.